Here, Dr. Seuss may be getting some competition from a doctor named Dr. Salhauser. He's a plastic surgeon, and he is breaking new ground on Mother's Day. The first children's book of its kind will be published. There it is, My Beautiful Mommy. What's it about? Well, it explains to children why mom is getting a tummy tuck or a nose job. The author says this book can help parents ease their children's anxieties before the mom goes under the knife. But you can imagine this is becoming controversial already. A lot of people are concerned that it glorifies beauty, will encourage kids to become obsessed with their looks when they're very impressionable. This is aimed at 4 to 7-year-olds. Let's take a look at what's inside. Here's an excerpt. Here's a page where a little girl asks her mommy why she's going to look different. Not just different, the mom says, prettier. And it shows a bubble where the mother imagines herself being crowned as a beauty queen. Then the little girl says, but you're already the prettiest mommy in the whole wide world. And the mom answers, that's sweet of you to say, my love, but mommy is also going to have to make her tummy smaller. You see, as I got older, my body stretched and I couldn't fit into my clothes anymore. Dr. Michael is going to help fix that and make me feel better. Those are a couple of pages from this upcoming book. Let's talk about it with psychiatrist and Fox News contributor Dr. Keith Ablow, and also Dr. Anthony Youn. He is a plastic surgeon. He's with Beaumont Hospital in Detroit. Dr. Ablow, first to you. I sent this to a couple of friends today who have kids in that age range, and every single comment was, I'm outraged. How can I possibly raise children with high self-esteem if this is what's out there?
Well, Jen, listen, I think that it's problematic. I think mothers who have 4 to 7-year-olds should really consider whether they want to noticeably change in dramatic ways their appearances when those kids are so impressionable. We really don't know the psychological ramifications on kids who lose that kind of connectedness. You know, your ability to resonate with somebody's facial expressions and face is very important. So what I would say is you might want to put your cosmetic surgery on hold if it's dramatic enough for your kids to notice.
You know, Dr. Ablow, I just want to let you know, too, is some of the parents wrote back on emails and said, not just 4 to 7-year-olds, I don't want my 12, 13, 14-year-old to be reading this and to get these kind of, you know, impressions.
Well, and I totally understand that. Listen, as a psychiatrist, I encourage people to talk more, not less. However, if you're getting a tummy tuck and you want to say to your kid who's 4 or 7 or 8 or 9, listen, I'm going to Florida and I'm going to come back and I think I'm going to feel better. I need some time away. I don't know if you have to say, and by the way, I'm going to an OR, I'm going to get anesthesia, my doctor's name is Dr. Michael. I don't think it matters.
Dr. Youn, it is, I can imagine, though, somebody in your position, probably a legitimate concern. You have patients who come in and say, how do I explain these dramatic changes to my kids?
Well, and that's true. Last year, over 400,000 young mothers had plastic surgery, and so I think it is inevitable, unfortunately, that the subject of plastic surgery may come up with small children. And so the idea of having some type of tool, if it is absolutely necessary, I think is a valid one to talk with them about it.
Dr. Youn, we see, as you said, this plastic surgery is on the rise. It's not going anywhere. I mean, what do you tell your patients to do?
Well, I think the most important thing is, and the reason why I don't agree with this book, is not to over-stylize or to make plastic surgery just for vanity's sake. I think if we absolutely need to expose our children to plastic surgery, we do so as more of a medical procedure, as a reconstructive or a reparative type of an approach, not just because I want to be more beautiful.
Yeah, Dr. Ablow, you agree?
I do agree. Listen, I am not one of these psychiatrists who says beauty is totally within. I do think plastic surgery can be helpful to people, but I think there's a risk. You know what? If you start opening Pandora's box and you say, I'm changing my nose, I'm changing my lips, be prepared, I'm still your mommy, but I'll look different, you're going to have kids looking in the mirror saying, well, what about my nose and my lips? Should I have this done?
Man, quite a debate. Dr. Keith Ablow, Dr. Anthony Youn, thanks to both of you.
Thank you.